you. I really appreciate, first I want to say I really appreciate the John Locke Foundation for inviting me as a guest speaker. I have always held their organization in very high esteem and quite frankly use it often for my own research because they do such great work. So it was a real treat and honor for me to be invited to speak to you about this today. And I am going to tell you just a little bit about myself only because I think it makes a difference, especially if we have any healthcare providers in this room, you know, why I have pursued this line of work. I spent over 20 years in healthcare. My husband is a doctor of pharmacy. He works for a medical device company, and together we have had lifetime careers in the field of medicine. And we have seen, since the late 1990s, the federal government increasing regulation more and more on our medical profession. And as a result, it has cost millions of dollars for our healthcare industry to comply with these regulations. Well, back in 2009, I was actually in a master's degree program, and it was a health policy class, and we were in Washington, D.C., while the Affordable Care Act was actually being voted on, which was right at the end of the year before Christmas. If many of you remember, it was actually passed in the dead of night during the holidays. And when I walked up and down the halls of Congress, the ringing of the telephones was just, it literally was vibrating the building. I've never heard so much outcry from the people in our communities that wanted our legislators to vote against this legislation. And I even carried letters with me to our elected officials in Guilford County to tell them that the doctors do not want you to pass this bill and to vote no. And so, of course, we know what happened, and I don't know, I just felt like I had to do something, and I could no longer just stand by and watch all the regulations and all the new laws destroy medicine in America. So I decided to start a consulting company, and through a lot of education and work through professional associations, I became a certified healthcare compliance and ethics professional. And my mission has been to be out in the community to educate our physicians, medical providers, small business owners, and really whoever is willing to listen to me, to say we've got to stop this, and then we've got to not only stop this legislation, but we've got to stop regulation and the impact it's having on our economy. So with that being said, we'll go ahead and start with the presentation. So a lot of people, especially small business owners, they understand what regulation means in a monetary sense because they know they have to comply, and usually that costs them money. But for many people, they don't understand, well, where does regulation come from? Unless you're astute enough to understand that when laws are written, that have rules or regulations that have to actually accompany laws to implement the law and to enforce the laws. So a rule or order can be issued by an executive authority or a regulatory agency. And this is really it has the same force as law, and it carries possible civil and criminal prosecution and fines if the organization that's affected by the regulations and rules do not comply. So the thing that I find the most concerning, it would be interesting to find out if it has any bearing on the IRS decision to offer the subsidies for the state and federal, even though it's not specific in the law, is there is something called the Independent Payment Advisory Board. And I feel that this is actually a constitutional issue, and I'm hoping that maybe this challenge will bring this into play. In that the law that they give this bill, the Affordable Care Act, gives this advisory board legislative or lawmaking authority. So it basically circumvents our elected officials in Congress. So when the board actually, they call it propose, but if once they submit a proposal to Congress, then it automatically becomes a law unless the House, combined with the Senate, and the President can agree on a substitute. If that can't happen, and it wouldn't happen today because of the majorities that we hold in the House versus the Senate and our presidency, then it would automatically become a law. So basically, you've just given legislative authority to a regulatory agency. And this bill gives extensive regulatory authority to the Department of Health and Human Services, who, as I will show you, works very closely with the IRS. And actually, by 2017, there will be additional provisions that restrict lawmaking powers of future Congresses. So this is something, regardless of what else happens, somebody's got to bring this to the Supreme Court for a challenge, because If we don't change it, as I said, that the bill stand or the law stands, if we don't change it, I think we're going to see a lot more dire consequences than what we're currently facing. And I promise I will answer a lot of questions at the end. So the U.S. Department of Health and Human Services Secretary Catherine Sebelius, we hear her name a lot in the media, well, she is granted the primary authorities to propose and implement the Affordable Care Act. And of course, the U.S. Department of Health and Human Services has to work very closely with a lot of other regulatory agencies, and together they come up with these proposals. But she will also be working with this Independent Payment Advisory Board for these type of regulations that they'll try to impose, or will impose, I should say. And these are some of the other agencies. And as a business owner, you know you can just look through the list. Many of those are agencies that you probably have to deal with already that have imposed regulations on your business. So I find this website very interesting, and I do encourage you to go to it. The House Ways and Means Committee has put together what they call the Affordable Care Act Burden Tracker. There is a federal law that mandates whenever a new law is passed that agencies have to give an estimate of the paperwork burden in hours, not cost, unfortunately, but in hours of manpower that it would take to actually implement and enforce a given law. So currently the Affordable Care Act has, and when I wrote this 1 week ago, it had 157 new regulations. As of last night, I just checked out of curiosity, it's already up to almost 180 new regulations in 1 week. It has gone up that much. As I said, the agencies are required by law to submit this information. So this is not just someone came up with these numbers. This is actual agencies that are involved in this regulatory process that actually produce this information. So as of a week ago, they estimated that we had almost 128 hours of burden for paperwork that we related to in implementing and enforcing the regulations that are associated with just this one law, the Affordable Care Act. So if you break that down for just the IRS, you're looking at a very large number. So you can actually see, I'll make sure I get this right, it breaks out the specific hours for each one of these things. And if you're a small business owner, I'm sure you have to do this annually. So with all the new regulations coming about, it's going to add to what you're already currently doing. And so that's why it will place a burden on your business, because most likely you may have to hire someone additional to help you with this burden, or get educated more on these issues so that you can actually comply. So there's a lot of different expense involved, and time. So I did a little math of my own as a small business owner. I wanted to see what this would mean to the bottom line. So I took the old projections of 128 million hours and just broke it down a little bit. That would mean over 3 million dedicated full-time employees, and that would be 40 hours, not 30 hours. At an annual cost for a compliance professional, an average cost is $30 per hour. So you would have to hire a full-time compliance professional at $62,400 annually to help you with the compliance for the regulations being imposed. And this means $3.8 billion annually to comply. That's what is going to cost the economy and the American business people to actually comply with this law. But it's going to save us money, remember? So just think about our current economy and really how we're all suffering. Lack of jobs, just everything about our quality of life has taken a hit because of some of the poor laws and the regulations that accompany those. Well, what could we do with $3.8 billion annually to help our economy? I mean, it really is staggering when you think about with our deficit and our economy the way it is, what this amount of money could actually do for us to help things. So, you know, we're talking to our small business owners here today, so I thought it would be interesting to see what, you know, how does regulatory cost actually impact you compared to, say, a large business? You would think a large business, they probably have a lot more issues they have to address or things to be concerned about. But in fact, it's actually the small business owner with less than 20 employees that bears the largest burden disproportionately for regulation. So your larger employers, obviously they do have probably a few more issues that they have to be concerned with. But really, if you look at your small business owner, they're the ones that are suffering. And especially with this economy, you have more and more small businesses that are starting up, entrepreneurs finding, creating work for themselves and feeling the need. But they are the ones that are going to carry this burden. So really what I am very specialized at is helping the medical provider, who's also a small business owner. So they have double burden, if you think about it, because if they are not owned by some large hospital, they actually have to comply with this law. So not only do they have to comply with it as a small business owner who has employees and have to comply with the same issues that any small employer would have to comply with, they also have the regulatory burden of the new mandates within this law for compliance on existing state and federal health care laws. So what I do is I actually go in and I give them a free assessment to see where they stand in regards to what's called the Effective Compliance Program. So since the late 90s, the federal government, along with Health and Human Services and the Office of Inspector General, they've been producing these voluntary compliance programs for healthcare providers. And it started with some laboratories and different things, and it has been developed over this time. So now all of a sudden this law has changed the voluntary compliance programs to mandatory. So now physicians to participate with Medicare and Medicaid services, meaning to treat patients that get coverage through Medicare and Medicaid services, they have to have a compliance program. And let me tell you, I've been out there for at least a year beating this drum, trying to get my medical providers to understand this is a very serious issue and they need to pay attention, but they're so overwhelmed with all of the things that are changing, they can't really, it's like they can't absorb the information at this point. But the bottom line is, the 7 elements is what they're going to be held to, which means they have to have updated written policies and procedures. And just in the last 2 months, we've had 2 new rules that have been imposed, the Physician Sunshine Law, as well as Payment Sunshine Law, and as well as the HIPAA final rule for the omnibus rule has changed. So it's like every month there's something changing. So they have to not only update policies and procedures, they have to provide training on the new policies and procedures. Somebody's got to do that understands it. They have to have compliance personnel to give oversight to make sure that everything's operating within compliance. The education and training is ongoing. And they have to communicate regular, they have to monitor through auditing. Auditing is very expensive. Imagine going in and auditing 6,000 patients' records to see if you've misbilled something. And this is very important, the enforcement. When they find something, there are certain ways that they have to report. It's almost like they mandate you have to report when you find anything, you have to report to the federal government. And it mandates that each employee has a legal obligation to report on each other as well. It also amends the health law's administrative sanctions, the evidentiary standards, which are reduced, meaning it's easier now for them to prosecute you. They've actually reduced those standards. It imposes new and higher criminal and civil monetary penalties for violations of these are some of the laws I spoke about earlier that have been imposed since the late 1990s. The False Claims Act, which is directly related to billing and coding issues. HIPAA, which is patient privacy and security. OSHA, which is your occupational safety issues that many of our small businesses have to deal with. Anti-kickback statute, Stark Law, Physician Sunshine Law, and more. I mean, you wouldn't believe the laws that our physicians are having to comply with just to practice medicine. So that's why I tell a lot of my small business owners and just, community groups, the next time you see your doctor, thank you. Because you know what? If we didn't have people that cared about people, that wanted to help you and treat you, they wouldn't do this. Because they really do it for the empathy, not for the money. Trust me, even though that's what you're being told. The penalties, if they are found to not comply, are anywhere from $5,000 to $100,000 per incident, exclusion from government programs, and imprisonment. And you think, oh, well, they don't do that often. Go on the OIG website, they have an updated list on an ongoing basis, and they're going after single individual physician practices, and they are putting them in jail. This is another one of those issues that this law imposes. It's very troubling, and this is another one of those things that's starting October 1st. The government has contracted with a lot of private agencies that are hiring auditors that may have no background in any type of accounting or any of these issues, that have been trained on billing and coding, that are going to go in just randomly, selectively into these physicians' offices and look for fraud, waste, and abuse or non-compliance issues. And these auditors, what's problematic about it is that they get paid. They get a cut of anything they find. And I have been to recent legal meetings where, or healthcare law meetings where they talk about how these things are being escalated. They have to escalate all the way up to the top chain of command within this within these state and federal agencies. And these physicians are having to spend hundreds of thousands of dollars on lawyers to defend them, just to find out at the end that there's no credible evidence of any misconduct. But imagine what that's done to the physician's practice. Not only is it discredited him in the community, but it's also probably, cut his resources down to the point he may have to close his doors. So these auditors have no liability whatsoever. They can't be prosecuted. I guess the physician could sue them, but it doesn't have any money left to do that. I mean, I don't know what he would do. It also encourages whistleblowers in organizations. So if you don't have good policies and procedures around whistleblowing and non-retaliation for reporting and those type of issues to protect yourself against professional whistleblowers that jump from agency to agency, you need to get some, because this law has reduced the evidentiary standards so that now whistleblowers can report more easily, and it can be partnered with the federal government to pursue criminal action against you in investigations. All right, so we all have heard about electronic health records. This has been a huge burden on physician groups as well. In a recent survey, since 2008, expenditures per full-time physician have increased almost 28%, or almost $20,000 through 2012. Now that's $20,000 per doctor off the bottom line, just to comply with the Affordable Care Act's mandate that they transfer all paper records over to electronic health records, so they're put in this huge database. And of course, we're going to have to increase staffing to also adapt to that. So now, what is it about the Affordable Care Act that impacts just your average businessman? Well, employers must offer affordable and minimum value health care coverage for full-time employees if they have 50 full-time employees or their equivalents. And FTE, I want to clarify, means full-time equivalents. And a little more complicated than we have time to go into today, but there is a formula for that. So to avoid penalties, employees must offer insurance coverage and meet at least 60% of the premium costs. And the employee's share of that premium cannot exceed 9.5% of their household income to meet the affordable standard. If the employer-provided benefits do not meet the affordability standard, the employee may receive tax credits to purchase insurance on their own through the exchange, or subsidies if their income is between or below 400% of the federal poverty level. Okay, so this is some data that I pulled off of Kaiser that looks at the cost of insurance through 2013, and that's important because this does not represent the cost that we'll be facing once this Affordable Care Act is actually implemented. So we're looking here at the employer versus the employee share. And the annual cost is now up at over $16,000 annually. So I figured I'd do a little math of my own again. And so if we take a family of four who's at the 400% federal poverty level, which is $94,200, so that means someone making $94,200 could potentially get a subsidy that taxpayer funds. So the total annual insurance cost is $16,000. The employer must meet 60% of that, which is a minimum contribution, which would be $9,800, and the employee's contribution would be about $6,500. Now, it's only 7% of their annual income, so it meets that affordability standard. But we're going to talk about later how the interest is expected to jump up to 80% increase in premiums. The employee still only has to meet $6,500. Who's paying the balance? It's not the federal government. It's the employer. So will the employer have some discounted rates through group coverage? I don't know. We haven't seen anything on that yet. And I'll skip through this. We talked about subsidies. And basically here are your penalties. Employers with 50 or more full-time equivalents who do not provide insurance for their employees face a $2,000 penalty, and that excludes their first 30 workers. The employers with 50 or more who provide insurance coverage but fail to meet the affordability standard must pay a fine, whichever is less of these two options. $3,000 penalty per employee receiving the tax credit, or the $2,000 penalty for not complying. Don't feel bad, you're not alone. We've already talked about the impact on the medical profession, but look at the impact on our large industries, our healthcare industries. And you know, I can't really speak to insurance companies since I've not worked in an insurance company, but I can speak to pharmaceutical. I've spent most of my career in the pharmaceutical industry, and most people understand the cost that goes in, the cost of doing research and development. And we're spoiled in America. We have always had the best. People come here from all over the world to get access to our medicines and our devices and our imaging technology and things that actually save lives. And it costs money. So when we start pulling billions of dollars out of this industry, who's already compromised significantly on drug costs for this, you know, affordable care plan, you know, this is going to significantly impact our quality of health care in the United States. We are going to have less access to the latest and greatest. We'll be the ones flying overseas looking for the new technologies because they can't afford it to fund it. Matter of fact, they're already starting to move overseas to other countries like China. So in summary, regulation really has three significant effects on employment. It has macroeconomic effects, such as job growth, wage growth, levels of unemployment, and labor force participation, which we're already seeing. We have reallocation of labor in less productive ways. I'm already seeing this in my medical practices. They're having to take people out of clinical positions and put them in compliance positions to make sure that they're in compliance with some of these laws. So you wonder why you're waiting so long in the physician's office. They don't have enough staff. They can't do it all. And job loss due to the cost of regulation. Regulation, just like everything else, it raises the cost of production. And it causes prices to be higher and it reduces output. So the next time you're in some kind of political event and you have a politician, or hope to be politician, tell you that they are going to cut regulation, and then 2 years later they hold up and they go, look at all the bills I sponsored. Every law that they pass, unless it's a law or repeal law, comes with regulation and comes with costs that you're paying for. So the next time you decide who you're voting for, see who's going to actually promise to cut and repeal laws. And that's the person you want to vote for. So that's all I have to say today. Thank you. I appreciate your time.